Early figures on the number of deaths during last week's heatwave in southeastern Australia suggest it was responsible for hundreds of deaths. For more, I'm joined now by the Director of the Victorian Institute of Forensic Medicine, Professor Stephen Cordner. Professor Cordner, welcome. Just how many people died in Victoria last week and how does that compare to the average?
Well, look, we don't know the absolute number of deaths yet, Joe, but I'm the Director of the Institute of Forensic Medicine, and we receive the deaths of those whose deaths are reported to the coroner. Normally, every week we receive around about 100 cases or bodies. Last week we received 200. The bulk of that excess is due either directly or indirectly to the consequences of the heat wave. There would be probably at least a similar number of deaths which are not reported to the coroner but are also due directly or indirectly to the heat. That's based on the experience from the heat wave in 2009. So I think it is fair to say that there has been a large number of deaths due to the heat wave, either directly or indirectly.
So 100 is the average, about 200 last week reported at this stage. So you're expecting that figure could actually be higher for that week because some deaths are not registered just yet?
Some deaths are not registered just yet. Some deaths wouldn't have been reported to the coroner. So the final number comes when the Registrar of Birth, Deaths and Marriages has received all of the death certificates for all deaths in Victoria for the period, and that is compared with the same period averaged over the last 5 years, for example, and the excess is assumed, and there's obviously a bit of slippage there, but assumed to be due to the heat wave.
Are you aware of figures from any other states or territories yet?
I'm not yet, Joe. So in 2009 there was 370 excess deaths in Victoria. There was a number in South Australia, I think it was of the order of 60 to 80 excess deaths in South Australia.
Yeah, they're pretty extraordinary figures that will probably come as a surprise to many people.
Yes.
Who are the main people who fall victim in the heat?
Well, you're right that it's a surprise to most people, Joe, and I think in 2009 it was overwhelmed, of course, by the manifest, huge, powerful disaster of the bushfires, but actually on the numbers killed only half the number of the heat wave. Yeah. Those at risk are the elderly, the infirm, those with chronic illness such as heart disease or previous stroke, mental health issues, a touch of dementia, diabetes, chest conditions, and also those elderly people who are more isolated in the community, who don't have family or friends to check on them, often close the doors and close the windows and blinds, and don't have air conditioning, perhaps don't have enough in the way of showers or baths to cool themselves down, don't keep their fluids up. And of course the elderly don't sweat as much as fit and healthy people do, and their heart doesn't work as well to push out the blood to the skin so that heat can be given off. So there's a whole host of sort of factors interacting to make the elderly and the infirm vulnerable.
Does society really comprehend the dangers of these heat episodes?
Well, that's probably right, that we don't sufficiently, so that goes to the importance of messaging and information and informing the community, and it also goes to encouraging everybody in the community to be looking out for family, friends, neighbours, and those that perhaps they know are a little bit recluse or isolated in their local communities.
Yeah, so do you think there should be a real effort to engage in more preparation for these events with a greater emphasis on warnings? Because, yeah, as you mentioned before, these figures would come as a surprise to many people, because from what you're saying, it will probably end up being the case that there were around 200 deaths in Victoria during that period that could be attributed to the heat.
Well, I need to be careful because I'm not a public health specialist. I'm a forensic pathologist, but and I did see that the president of the AMA said he thought the community messaging had been good. So I'm not about to criticise that, but I'd certainly emphasise the importance of it.